Welcome, and thank you for attending. Let's get started with photodynamic therapy in your physician office. Please note the important safety information and refer to your package insert for full prescribing information on Levulin Caristic plus Blue U. Important safety information. Levulin Caristic aminolevulinic acid HCl for topical solution 20%, plus blue light illumination using the Blue U Blue Light Photodynamic Therapy Illuminator is indicated for the treatment of minimally to moderately thick actinic keratoses of the face or scalp, or actinic keratosis of the upper extremities. Contraindicated in patients with cutaneous photosensitivity of wavelengths of 400 to 450 nanometers, porphyria, or known allergies to porphyrins, and in patients with known sensitivity to any of the components of the Levulin Caristic topical solution. Application of Levulin Caristic topical solution should involve lesions on the face or scalp or upper extremities. Multiple lesions can be treated within a treatment region, but multiple treatment regions should not be treated simultaneously. Do not apply to the eyes or to mucous membranes. Irritation may be experienced if Levulin Caristic topical solution is applied to eyes or mucous membranes. Treatment of upper extremities is approved after an incubation time of 3 hours under occlusion. Excessive irritation may be experienced if this product is applied under occlusion longer than 3 hours. Transient amnestic episodes have been reported during post-marketing use of Levulin Caristic in combination with Blue U Blue Light Photodynamic Therapy Illuminator. Inform patients and their caregivers that Levulin Caristic in combination with PDT may cause transient amnestic episodes. Advise them to contact the healthcare provider if the patient develops amnesia after treatment. After Levulin Caristic topical solution has been applied, the treatment site will become photosensitive and patients should avoid exposure of the photosensitive treatment sites to sunlight or bright indoor light. For example, examination lamps, operating room lamps, tanning beds, or lights at close proximity for 40 hours. To avoid unintended photosensitivity, Levulin Caristic topical solution should be applied by a qualified health professional to no more than 5 mm of perilesional skin surrounding each target actinic keratosis lesion. Important safety information continued. Advise patients to wear a wide-brimmed hat or a similar head covering of light opaque material or a long-sleeved shirt and/or gloves to shade the treated actinic keratoses from sunlight or other bright light sources until at least 40 hours after the application of Levulin Caristic topical solution. Sunscreens will not protect against photosensitivity reactions caused by visible light. The patient should be advised to reduce light exposure if the sensations of stinging and/or burning are experienced. Levulin Caristic topical solution has not been tested on patients with inherited or acquired coagulation defects. It is possible that concomitant use of other known photosensitizing agents such as St. John's wort, griseofulvin, thiazide diuretics, sulfonylureas, phenothiazines, sulfonamides, and tetracyclines might increase the photosensitivity reaction of actinic keratoses treated with the Levulin Caristic topical solution. During light treatment, both patients and medical personnel should be provided with blue-blocking protective eyewear as specified in the Blue U Blue Light Photodynamic Therapy Illuminator operating instructions. The most common local adverse reactions, incidence greater than or equal to 10%, were erythema, edema, stinging or burning, scaling or crusting, itching, erosion, hypo or hyperpigmentation, oozing, vesticulation or crusting, scaling, and dryness. In clinical trials, severe stinging and/or burning was reported by at least 50% of face and scalp patients and 9% of upper extremity patients at some time during treatment. However, less than 3% of subjects receiving treatment for face or scalp lesions discontinued light treatment because of stinging or burning. No subjects discontinued light treatment in the trial for upper extremity lesions. Please see full prescribing information at www.dusapharma.com, as well as provided at this presentation. In this presentation, we will cover setting up PDT in your practice, coverage, coding and billing, reimbursement, economic considerations, sun dermatology support, summary. These are the necessary steps we will address to help you get started setting up PDT in your practice. Resources: equipment, space, staffing. Verify allowed amounts for top 5 contracts. Set or adjust fee schedule for CPT and J-code. Determine appropriate patients. Verify eligibility and benefits. Schedule patient. Treatment, documentation. Bill claim. What does it take to perform photodynamic therapy? It takes resources like time, space, and equipment. These are all manageable resources, so let's look at each one specifically. Treatment time. Application and incubation of Levulan Stick per the label, 14 to 18 hours for face or scalp and 3 hours for the upper extremities. Blue U treatment. 16 minutes and 40 seconds per treatment. Space. Blue U when in use is approximately 3 feet by 3 feet. Blue U when stored is approximately 2 feet by 3 feet. During treatment, a 7 feet by 9 feet area is recommended. Equipment: chair, Mayo stand, or similar for extremities. Blue U light. Proper documentation is a key part of the billing and reimbursement process. Record keeping should include pre-treatment information sheet on what to expect, similar to pre-surgery sheet. Informed consent for treatment. Take photos or diagram the area to be treated. Number and location of lesions. Medical necessity documentation. Plan of care. The appropriate ICD-10 diagnosis code, such as L57.0 for actinic keratosis, and document the number and location of the lesions needing treatment. The appropriate CPT code, HCP level of involvement throughout the treatment to help support the CPT code build, particularly if billing the new codes 96573 and 96574. Lastly, provide the patient a post-care instruction sheet. How do you get Levulan Stick for your patients? There are 2 ways your office can obtain Levulan depending on the patient's coverage benefits. The first option is the medical benefit shown here, also known as the buy and bill method. The physician prescribes Levulan Stick PDT. The office staff then verifies benefits and obtains a prior authorization or predetermination if needed. The patient is then scheduled and the healthcare provider provides education and treats the patient. This is a 1 or 2 visit therapy, depending on whether treating the face or scalp or upper extremities. Treatment should be performed by a qualified healthcare professional, QHP. The claim is then billed to the insurance for both the appropriate CPT procedure code and the HCPCS code J7308 for Levulan Stick. Finally, payment is remitted. Sun Dermatology is happy to assist you with this process. By forwarding the necessary information, they can check the eligibility and benefits for the patient and determine the patient's out-of-pocket costs for their co-payments, co-insurance, and deductibles. We will get into more detail later in the presentation. That explains the buy and bill method. The pharmacy benefit is the second possible option, but please keep in mind this only applies to patients with coverage under the pharmacy benefit versus medical benefit. With the pharmacy benefit process, the physician prescribes Levulan Stick PDT, and the patient is scheduled. The office staff sends the prescription to the pharmacy, and the pharmacy processes the order by confirming patient eligibility and coverage. The pharmacy identifies coverage and collects copay from the patient. The patient can then be treated when the prescription arrives at the office, and the claim can then be submitted for the light session only using the appropriate CPT code of 96567, 96573, or 96574. For some plans, you may submit for multiple Levulan Caristics if required. When scheduling the patient, be sure to allow enough time for this process to be completed to ensure the prescription has been shipped and is available when the patient arrives for treatment. We will cover this process in more detail later in the presentation. As we just discussed, Levulan may be available under medical benefits via buy and bill or pharmacy benefits through specialty pharmacy. Now let's take a closer look at coverage considerations for Levulan. To determine coverage, it is necessary to verify the patient's insurance eligibility and benefits. This can be done either online through the payer portal or by phone. Pinnacle can also assist with this process. You should research the patient's benefits, including medical or pharmacy coverage, copay, coinsurance, and deductible. The benefit verification is also necessary to ensure you provide Levulan through the appropriate access channel. While some payers and plan designs allow coverage for both options, others may limit coverage exclusively through medical or through pharmacy benefit, but not both. We will talk about this more as we continue through the presentation. After you identify coverage, be sure to review this information with the patient to let them know their out-of-pocket costs for the treatment. Coverage for Medicare is a National Coverage Determination, NCD, which provides coverage with no limitations. However, Local Coverage Determination, LCD, for your Medicare administrator may provide patient selection criteria. The Levulan Caristic is reimbursed at 106% of manufacturer average sales price for Medicare. Average sales price and reimbursement values for Levulan Caristic, J7308, are updated quarterly. Coverage by non-Medicare payers is based upon plan limitations including body site-specific coverage, limited number of treatments, or Levulan Caristics, and some may require a specified number of lesions. Payment for Levulan is typically established as a percent of average wholesale price. Sun Dermatology can show you where to find the average wholesale price quarterly announcements. There has been a recent update to the Levulan Caristic label, which is important to discuss as it relates to insurance coverage. As you know, Levulan Caristic, aminolevulinic acid HCl, for topical solution, 20%, plus blue light illumination using the Blue U Blue Light Photodynamic Therapy Illuminator is indicated for the treatment of minimally to moderately thick actinic keratoses of the face or scalp. Recently, the FDA approved a new indication for treatment of upper extremities. This change was effective as of March 16, 2018. It is important to note that in the Levulan Caristic package insert, upper extremities is defined as arms and hands, does not include chest or back. Because this new clinical indication is unique to Levulan Caristic, this means it does not apply to any other formulation or variation of aminolevulinic acid. Therefore, coverage policies may be different and possibly more restrictive for other formulations. You can refer to the package insert for the complete label update. What does this new indication mean for you and your patients regarding insurance coverage? A new clinical indication does not necessarily guarantee coverage for upper extremities. We know that currently some payers limit coverage to face and scalp only. With this in mind, some payers only update policies at specific designated times throughout the year, and therefore may not cover a new indication until their next policy review, which may be on a quarterly or biannual basis, for example. This is why it's always important to verify benefits and number of sticks requested prior to treatment. Some additional coverage considerations to keep in mind are policy restrictions that might impact the ability to treat upper extremities. Examples of this could include stick limitations, step edits, face and scalp coverage only, to name a few. We know many Blues plans tend to have restrictions that limit coverage to non-hyperkeratotic lesions of the face and scalp only. Therefore, coverage may continue to be limited until policies update. We also know that Aetna has a step edit in place and restricts coverage to one treatment stick. This could create a challenge when trying to treat larger surface areas such as arms. Based on some of these nuances, you can clearly see the importance of identifying patient coverage prior to offering treatment. Once coverage has been confirmed and you have treated the patient, the next critical step is proper coding and billing for the Levulin treatment. In this section, we will review this process, as well as discuss pertinent changes to PDT coding effective this year. When using the buy and bill option for Levulin PDT, the office would bill for the service and the Levulin stick utilizing the most appropriate ICD-10 code, such as L57.0, the J code J7308, and the appropriate CPT code 96567, 96573, or 96574 for the treatment performed. Please note that J7308 is the J code assigned only for Levulin and no other product. Photodynamic Therapy CPT Update. The American Medical Association, AMA, CPT editorial panel recently approved the addition of 2 new CPT codes for photodynamic therapy. As the designated standard for the electronic reporting of physician and other healthcare professional services under the Health Insurance Portability and Accountability Act of 1996, HIPAA. CPT codes are updated annually and effective for use on January 1 of each year. The AMA prepares each annual update so that the new CPT books are available in the fall of each year preceding their effective date to allow for implementation. Effective January 1, 2018, the existing photodynamic therapy CPT code 96567 was revised, and 2 new codes were added. The codes and their descriptions are as follows. 96567. Photodynamic therapy by external application of light to destroy premalignant lesions of the skin and adjacent mucosa, for example lip, by activation of photosensitive drug or drugs per day. 96573. Photodynamic therapy by external application of light to destroy premalignant lesions of the skin and adjacent mucosa with application and illumination or activation of photosensitizing drug or drugs provided by a physician or other qualified healthcare professional per day. 96574. Debridement of premalignant hyperkeratotic lesion or lesions followed with photodynamic therapy by external application of light to destroy premalignant lesions of the skin and adjacent mucosa with application and illumination or activation of photosensitizing drug or drugs provided by a physician or other qualified healthcare professional per day. It is the physician's responsibility to bill to the highest level of specificity for the treatment provided. It is important to note that the Blue U blue light treatment is billed using the appropriate CPT code for the treatment performed and should be used to report a single PDT treatment per patient per day, regardless of the length or number of lesions treated. If billing 96573 or 96574, the qualified healthcare professional must be involved in both components of the procedure. A qualified healthcare professional refers to a healthcare provider with an NPI number who can bill independently under their name, MD, DO, NP, PA. This would not include medical or technical staff, such as nurses or medical assistants. It is important to properly document the involvement of the HCP in chart notes. The CPT codes have no global period, and therefore follow-up evaluation and management codes may be billed when appropriate. The National Average Medicare Physician Fee Schedule allowable for this service is determined by Medicare annually. Physician payment will vary based upon the geographic payment locality adjuster. Levulan Caristic is billed using the HCPCS code J7308, which is described as aminolevulinic acid HCl for topical administration 20%, single unit dosage form, 354 mg, and is reported for each unit utilized for the treatment. Question: can I use more than one stick? Answer: yes. You can use more than one stick if needed to provide adequate coverage of the area being treated. For those plans that allow for coverage of multiple sticks, you can simply change the quantity. Be sure to verify patient benefits before treating with more than one stick. As we mentioned earlier, Levulan now has a new indication for upper extremities. This may require the use of more than one Caristic to treat a large number of lesions. Here are some key points to consider when using multiple sticks. 1 CPT code per day. As stated in the new and revised CPT code descriptors 96567, 96573, and 96574, should only be billed for one session per day. Best practice is to bring patients back on a separate date of service for additional treatment sites. If you have specific questions around this, please contact the applicable payer or your field reimbursement manager for assistance. In addition to billing the appropriate HCPCS and CPT codes, it is also important to properly document the National Drug Code, NDC, on claims when required by payers. For billing purposes, you must use the 11-digit NDC and not the 10-digit NDC found on the product packaging. Failure to accurately capture this information will likely result in a rejected claim. Some EMR systems, such as EMA, require the NDC to be entered on all claims when billing for physician-administered drugs with J-codes, in which the claim cannot be submitted until the NDC field is completed. This requirement offers an added safeguard to ensure it is included on the claim. Best practice is to capture the NDC regardless of your EMR, since there seems to be a trend among payers starting to require the NDC. The example provided here illustrates the proper billing protocol for Levulan on electronic claims. This information can be found in the Levulan Billing and Reimbursement Guide provided by Sun Pharma. This slide illustrates the proper NDC billing format for Levulan on the CMS 1500 form. The NDC needs to be captured exactly as shown in the shaded area of box 24A, along with the unit of measure. Please note once again the 11-digit format, as well as no spaces or dashes in the NDC. You can see in this particular example, 2 sticks are being billed. Best practice when billing multiple sticks is to include a note or documentation of medical necessity for more than one stick. This information should be captured in box 19 or the free text field on electronic claims. Include the anatomical area treated and be sure to indicate 2 units on the J7308 line item box 24G. If you have additional questions, your FRM can assist. Now that we have covered the proper coding and billing requirements for Levulan Caristic PDT, let's discuss how this translates to reimbursement of submitted claims. How is reimbursement determined? Medicare and commercial payers may have different methodologies for reimbursement of physician-administered buy-and-bill drugs with a J-code. Medicare reimbursement is calculated as average sales price, ASP, plus 6%. This rate is updated and published quarterly on the CMS website. For buy-and-bill drugs, this tends to be a standardized reimbursement methodology. However, commercial payers may or may not follow Medicare reimbursement. For those payers that do follow the Medicare fee schedule, your commercial payer rates should update and adjust automatically if the Medicare rate changes. If this is the case, and your reimbursement with commercial payers does not accurately reflect the current quarter's reimbursement rate for Medicare, then you would have grounds for a successful resubmission of a claim. This scenario may apply when Medicare reimbursement changes and a commercial payer does not update to adjust reimbursement immediately at the start of a quarter due to lag times in their system. You will want to monitor your reimbursement frequently to ensure timely filing if the need arises to resubmit underpaid claims. Some commercial payers may not follow Medicare and rather calculate reimbursement based on average wholesale price, AWP, plus or minus a percentage. It is very important to understand your payer contracts and the methodology for which you are reimbursed. Contact your FRM for assistance if you have questions or concerns around reimbursement. The reimbursement methodology for CPT codes is as follows. The National Medicare Reimbursement Rate for J7308, reflected here, represents Q2, 2018. Due to the fact that reimbursement is based on the average sales price methodology, please refer to the current Medicare fee schedule each quarter for changes and updates. The CPT code reimbursement rates are $116.64 for the 96567 code, $193.32 for the 96573 code, and $249.12 for the 96574 code. The CPT reimbursement rates cited here are based on the CMS or Medicare fee schedule national averages. Actual reimbursement will vary slightly due to adjustments for locality and geographic wage index. These rates are fixed for the 2018 calendar year and are not subject to quarterly changes like the J-code. Blue Cross Blue Shield plans vary. Most publish a participating PAR fee schedule and will reimburse on a sliding scale of that schedule. How the PAR fee schedules are created is not transparent. Fee schedule access may be difficult. Website access, online portal. Example: the first year may be 103% of the PAR schedule, changing to 105% in the second year. The next few slides provide examples of insurance portals in which you can obtain fee schedule contracted rates for insurance payers. Most insurance companies have this access. First, we have the Humana portal and the area to obtain the fee schedule or allowed amounts. Next, we have the United Healthcare portal and again, how to obtain the fee schedule or allowed amounts for your contract. When offering Levulin within your practice, it is important to identify and/or establish your commercial payer contracted rates for the CPT procedure codes, as well as the Levulin HCPCS J7308 code. Choose the top 5 payers in your office as a starting point. For CPT codes 96567, 96573, 96574, you can refer to the Medicare fee schedule as a benchmark when negotiating your payer contracts, since Medicare is an ideal frame of reference to help establish appropriate payment for services. As previously stated, keep in mind for CPT codes, Medicare reimbursement varies per the geographic adjustments by locality. For reimbursement of the HCPCS code J7308 for Levulin Carastick, you should be reimbursed adequately to cover your product cost. Refer to the Medicare fee schedule as a reference to negotiate and set appropriate contracted allowable rates. Medicare reimbursement for J7308 is set on a national level and is not impacted or adjusted by locality. Geographic adjustments apply only to CPT procedure codes, not supplies such as drugs. We have covered all the important components to Levulin regarding coverage, coding, billing, and reimbursement. So now let's consider some of the economics of PDT within your practice. Medical or pharmacy benefits. How do the two options compare for your practice? The medical benefit allows your physician office 90-day payment terms and an auto-ship program with multiple tier discounts, as well as the flexibility for immediate treatment with on-hand inventory. The pharmacy benefit means no inventory to carry and no outlay of cash, but you need to make sure that the prescription arrives prior to the treatment day. Keep in mind, Levulin is most commonly covered as a medical benefit, and therefore, not all insurance plans will allow access through the pharmacy benefit. When can I use buy and bill, and when can I use the pharmacy option? For Medicare patients, there is only one option, and that is buy and bill. This is because Levulin is covered as a medical benefit under Part B coverage. Some commercial insurance companies allow for the buy and bill method or the pharmacy channel. Regardless of how Levulin is covered, Foundation Care is the sole distributor for both channels of distribution. Let's discuss these options further to help you identify the best option for your office. When using the buy and bill model under the medical benefit, you will need to stock inventory. There are various purchasing options available for Levulin. The cost currently ranges from $316 to $385 per unit, depending on the discounted auto-ship tier. All product ordering support is available through Foundation Care. You can see the contact info here, including phone, email, and eScript ID for prescription submissions. What if I prefer the specialty pharmacy option? Let's walk through the pharmacy process. Foundation Care is the pharmacy service that will receive the prescription and verify the pharmacy benefit, including copayment and out-of-pocket costs. Foundation Care then contacts the patient to confirm and review the benefits. Once approved by the patient, Foundation Care will contact the physician office regarding insurance benefit approval and shipment date. The Levulin Carastick will arrive with a prescription label that includes the patient's name. With this option, be sure to prescribe the number of Carasticks expected to be used at the time of application. Record in the prescription notes the date the patient's treatment is scheduled. Verify patient's benefits for the light procedure of CPT 96567, 96573, or 96574. You can also verify the patient's J7308 medical benefit coverage for future use to determine the best possible option for the patient. Keep in mind, not all patients will be covered for Levulin as a pharmacy benefit, and if not, they may have coverage under the medical benefit instead. Now that you have a good understanding of the Levulin process and the economic considerations for implementing Levulin in your office, let's review the resources Sun offers to help support your practice. Sun is highly dedicated to supporting your practice and your patients to ensure successful access to Levulin. Some of the available resources for you are territory managers to assist with implementation and clinical in-services. Ideally, you should have 3 to 4 in-services a year. They can also assist with ongoing support as need arises in your practice. Field reimbursement managers are available to assist with billing, coding, and reimbursement support, as well as managed care coverage and payer policy updates. They can also provide resources through the sunaccesssupport.com website. Additional medical benefit support is offered through Sun Dermatology. Let's look at the services offered. sunaccesssupport.com is a one-stop shop where you can find available resources and tools to assist you with Levulin. As you can see here on the homepage, the 3 key areas of support include reimbursement, contracting, and purchasing. To log on to sunaccesssupport.com, simply enter your first name, last name, email address, and any physician's NPI number on the login page. Within the Sun Access Support website, under the Reimbursement tab, you will find materials such as sample template letters to guide you with payer requests and communication. Examples include suggested templates for requesting review of a denied claim, requesting increases in contracted rates, prior authorizations, etc. You can also find forms for Pinnacle assistance, such as the Benefit Investigation Request Form. These are just a few examples of the various resources available on sunaccesssupport.com. This is an excellent resource, and if you have not yet been to this website, we strongly encourage you to check it out. Your field reimbursement manager can also walk you through the available resources on this site. In addition to your field reimbursement manager and sunaccesssupport.com, Sun Dermatology also offers support services through a third-party vendor, Pinnacle. They can aid in the photodynamic therapy reimbursement process by assisting with patient benefit investigations, pre-certification, or authorization, provider claims appeal. They also have a reimbursement hotline that can help address coding, billing, claims payment and denials, research payer policies, provide updated policy information as necessary, and help get the top 5 plan reimbursement allowed amounts. You can reach them by email, phone, or fax. In summary, we know that coverage for Levulan photodynamic therapy is widely available to patients through the majority of payers. You may have the option to offer Levulan to your patients through the medical or pharmacy benefit depending on individual patient coverage. This can allow for added flexibility to your practice for accessing Levulan. And finally, Sun Dermatology is committed to offering you a broad range of resources, support services, and expertise to help aid you with billing and reimbursement when utilizing Levulan within your practice. As we started with important safety information, we will also end on this note as an added reminder for compliance purposes. If you have additional questions, your FRM can assist.